Why is spontaneous respiratory rate important in sleep apnea? Have you ever wondered why the spontaneous respiratory rate matters so much when it comes to sleep apnea? This natural breathing rate plays a key role in understanding and managing this condition. Let's break it down together. Spontaneous respiratory rate refers to how fast a person breathes without any outside help, like machines. In sleep apnea, where breathing can stop and start during sleep, this rate becomes essential for several reasons. First, it helps with diagnosis and assessment. If someone has a higher than normal respiratory rate, it might indicate they are struggling to breathe or compensating for pauses in breathing. Next, let's talk about continuous positive airway pressure therapy, commonly known as CPAP therapy. This is a popular treatment for sleep apnea. Monitoring the spontaneous respiratory rate while using CPAP can help adjust the pressure settings. If the respiratory rate stays high even with CPAP, it could mean the pressure isn't sufficient or there are other issues that need fixing. Another important aspect is monitoring how well the treatment is working. If the spontaneous respiratory rate decreases during sleep, it suggests that CPAP therapy is effectively reducing breathing interruptions and stabilizing breathing patterns. Changes in the spontaneous respiratory rate can also signal complications. For instance, if the rate increases, it might indicate a respiratory infection or another issue that could complicate sleep apnea management. Finally, when healthcare providers analyze CPAP data, the spontaneous respiratory rate is a vital piece of the puzzle. It helps them understand a patient's breathing patterns and make necessary adjustments to treatment. This ensures that patients receive the best care possible to manage sleep apnea and improve their sleep quality. In summary, the spontaneous respiratory rate is a key metric in managing sleep apnea. It aids in diagnosis, treatment optimization, and monitoring effectiveness. By paying close attention to this rate, healthcare providers can tailor treatments to meet individual needs and improve patient outcomes.